Good morning, everyone. I'm Curie, a nephrologist from Korea. I'd like to express my sincere thanks to the organizers and the chairs, especially Professor Pham Gia Khan, Professor Dung Ban Hee, and Professor Nyo Kwai Chow for giving me this wonderful opportunity to present today. I have no conflict of interest to declare. Today, my presentation is a simple 5 parts, 1 story, overview of best practice in transplantation from Asia with a focus on kidney transplantation. I will now share an overview of organ transplantation activities across Asia, highlighting how countries have navigated and overcome their unique challenges. There are 47 countries in Asia according to WHO and World Bank classifications. So, naturally, there are many best practices across this vast and diverse region. The world reported over 1.7 million transplants in 2023. Nearly two-thirds of them were kidneys. Kidneys dominate in Asia too, 77% in Eastern Mediterranean region, 75% in Southeast Asian region, and 63% in West Pacific region. Altogether, Asia accounts for 36% of all kidney transplants worldwide. We used GeoDD data from 2019 to 2023, excluding the COVID years. During this period, kidney transplant activity rates in Asia increased overall. However, even within the same region, the variation in transplant activity is striking. Out of 47 Asian countries, only 27 reported to the GeoDT, that's just 57%. In Eastern Mediterranean region, only 2 countries exceeded 30 PMP. In Southeast Asian region, none, and in West Pacific region, only 3. So yes, progress is happening, but it remains uneven and fragile. Unequal transplant activity within Asian countries have a darker side. Asia became a hotspot for organ trafficking, and this is a reality we cannot ignore. AstraH is a kidney transplant database with real-time visualization and automated validation covering 227 variables. Right now, 9 transplant specialists from 7 countries are participating. And by 2025, the system had collected 3,600 cases. 77% of AstraH patients are from South Asia, providing key insight into kidney transplants there. The median recipient age is 41, much younger than 51 in Korea's Curie. The most common cause of kidney transplant was glomerulonephritis, which accounts for 53% of underlying diseases. The proportion of patients with diabetes or cardiovascular comorbidities was very low at 17 and 1.5% respectively. So, kidney transplant activities in Asia remains far lower than in Europe and the Americas, with wide variation across countries. And Asia still depends mainly on living donor kidney transplant. So, preventing CKD and strengthening LD living donor kidney transplant are key first step forward. Moreover, the 2023 ISN Global Health Atlas showed that most Asian countries, highlighted here in purple, carry a very high burden of kidney failure. This slide summarizes government-led CKD management policies across Asia in the past 5 years. Among those, Taiwan's policy is particularly noteworthy. Taiwan implemented a universal CKD care program known as Pay for Performance or P4P model. This program manages CKD stages 1 to 5 through team care and education with performance-based incentives. As shown in the study by Lin and colleagues, P4P has significantly reduced long-term trends in dialysis incidence. This program shows the value of dedicating government resources to CKD management. As the 2024 WHO Santander meeting highlighted, transplantation not only greatly improves survival but also far more cost-effective than dialysis, making it an ideal solution for LMICs. As you may know, living donor kidney transplants still far outnumber deceased donor kidney transplants in both the Eastern Mediterranean and the Southeast Asian region. The use of paired kidney exchange, ABO-incompatible transplantation, and the broader acceptance of marginal donors, all of which have significantly expanded access to living donor kidney transplants. India's kidney paired exchange program allows incompatible donor recipient pairs to exchange donor for a compatible match. Supported by the Transplantation of Human Organ Act, this initiative has expanded the living donor pool, shortened waiting times, and markedly increased the number of kidney transplants. Therefore, I'd like to highlight Taiwan's CKD management program and India's paired kidney exchange initiative as best practice in Asia. The next step to increase kidney transplant is expanding deceased organ donation and transplantation programs. The rate of deceased donor organ transplantation remains very low across Asia, with a large difference between countries. Among 24 Asian countries that submit data to GODT, 83% performed both living and deceased donor kidney transplants, while 17% conducted only living donor kidney transplants. And only few Asian countries exceeded global mean of 15 PMP in deceased donor kidney transplant activities. In abstract data, about 21.5% of kidney transplants were from deceased donors, most of them brain death from traumatic injury. Laboratory infrastructure remains fragile. 47% of cases were done without CDC T-cell crossmatch and 83% without B-cell crossmatch. In 2024, the TTS Congress in Istanbul, we hosted a seminar and workshop with low-middle-income country participants worldwide to discuss barriers to deceased donor organ transplant, and the meeting report was published in Transplantation. And this slide summarizes the common themes, barriers identified in low-middle-income countries: weak brain death legislation, limited government funding, cultural and religious misconceptions, shortage of trained staff, poor infrastructure, complex consent process, and geographic inequalities. At the root of many of these barriers lies a fragile economic foundation as emphasized in 2021 Transplantation paper by Moody. Not surprisingly, countries with higher Human Development Index achieve higher organ transplantation rates. Implementing deceased donor organ transplantation program always incurs cost for managing deceased donors. Without sufficient policy or funding support, program stagnates and the transplant tourism increases. When we compare the total kidney transplantation rates with HDI, we found a positive correlation of about 0.6 in Asia. Yet, 53% of Asian countries fall below the global trend line, showing that non-financial factors also play a major role. The gap is even wider for deceased donor kidney transplants. 73% of Asian countries fall below the standard line. Still, several countries such as Iran, Thailand, China, and Mongolia stand out with relatively higher deceased donor kidney transplant activity for their HDI, representing overcoming financial barriers in deceased donor kidney transplantation. Among the countries that have successfully overcome financial barriers, Iran and Mongolia stands out as remarkable examples. Iran's model combines strong regulation with mixed financing, public funding, drug subsidies, NGO partnership, and direct government support. Through national oversight, this system removed major cost barriers and ensured long-term sustainability. Government-regulated social funds cover surgery, insurance, and funeral expenses, along with benefits for low-income families. With strict regulation prevents brokerage, lifelong immunosuppressive drug subsidies are guaranteed. By sharing the cost burden across the society, Iran achieved notable success in deceased donor organ transplantation, as shown here. This model also helped address ethical issues in the former living unrelated donor program and significantly reduced dialysis-related costs. To build a stable and lasting deceased donor organ transplant program, government must establish a dedicated national body and allocate budgets according to their capacity. The leading example in Asia is Mongolia. In 2011, the country performed only 10 to 15 kidney transplants annually. Then, physicians trained abroad took the lead and persuaded the government and the public to make transplantation their national priority. They helped establish a national deceased donor organ transplantation body within the Ministry of Health to oversee regulation, coordination, and financing. Today, Mongolia operates an internationally recognized deceased donor organ transplant program that has expanded beyond the kidney to include liver and other organ transplants. In this section, I introduced two Asian best practices, Iran and Mongolia, where economic barriers were successfully overcome through national funding and through making transplantation a national priority. Next, I will explore how organ transplantation in Asia is shaped by diverse cultural and customary practices. At the 2025 ISODP Congress, a study entitled major obstacles to the development of organ donation and transplantation in Asia, conducted by Dr. Xiangxiang He, was presented. This study analyzed 370 responders from 13 Asian countries to identify key barriers in organ donation and transplantation. The questionnaire assessed 17 barriers across 4 domains using online survey data from multiple Asian regions. Participants were mainly drawn from WHO-defined Southeast Asia and Western Pacific regions, or World Bank-defined East Asia and the Pacific and South Asia. Respondents were well distributed across the age groups, and the survey included diverse stakeholders, with organ donation specialists accounting for 32%, alongside recipient and families, transplant professionals, social workers, volunteers, policymakers, and donor family members. The analysis framework consists of 17 obstacle factors grouped into 4 core dimensions: traditional cultural belief, legal and policy framework, medical resources, and public awareness. Based on average score, the main obstacles were traditional life and death belief, followed by family-centered decision-making, public misperception, limited awareness, and religious interpretative diversity. By dimension, tradition, culture, and public awareness were identified as the most critical barriers. In the cross-analysis, the top 3 obstacles remained consistent, with variation by region, age, occupation, and experiences, especially in public awareness and religious interpretation. Dr. Xiangxiang He's analysis identified culture as the primary barrier in Asia, driven by traditional belief and family-centered decision-making, followed by public awareness marked by misperception and limited outreach. Legal, policy, and resource barriers were secondary, showing regional patterns such as legal ambiguity in South Asia, resources and cost issues in the Eastern Mediterranean, and financial concerns among recipient groups. These findings align with the TTS 2024 working group, reinforcing that Asia cultural attitudinal barriers are the most critical dimensions, outweighing economic and policy-related factors. Building on this analysis, we will further explore solutions to overcome these barriers at upcoming TTS 2026. At the TTS 2024 workshop, 5 main cultural barriers to deceased donor organ transplantation were identified. Cultural and religious belief ranked as the most influential factor, followed by public distrust in the health system. Comparing 2023 with 2019, GODT data showed that deceased donor kidney transplantation is increasing in several Asian countries, including Malaysia, Qatar, UAE, India, and Thailand. In 2023, Thailand and China stood out. Over half of all kidney transplants came from deceased donors. So, in this section, we will focus on these 2 countries. Although all major religions support deceased organ donation, distorted interpretations rooted into the culture often lead to its rejection. Asia, home of most of the world's major religions, faces these challenges. Thailand, a prominently Buddhist country, once struggled with beliefs about disturbing the spirit, rebirth, and body integrity. Thailand overcame these barriers by reframing organ donation as an act of making merits a deeply spiritual contribution. At the center of these changes was the Thai Red Cross Organ Donation Center, which established a unified registry, transparent allocation, and strong family support. Through faith-based trust and national coordination, organ donation became a culturally acceptable practice. Temples became registration sites, and monks actively promoted the message that saving lives brings merit and influence rebirth. As a result, Thailand achieved broad public acceptance and participation. The second major cultural barrier is public distrust in the health system. This distrust arises from past unethical practices, weak legal safeguards, lack of transparency, and unequal access to transplantation. China fundamentally reformed its system after 2015, banning the use of organs from executed prisoners and building a national donation and allocation framework. The government established COTRS, the China Organ Transplant Response System, a nationwide digital platform operated by the National Health Commission and the Red Cross. Its automated matching system guarantees fairness, transparency, and accountability, while continuous data integration supports quality control and national oversights. As a result, China performed more than 24,000 organ transplants in 2024. The key lesson is clear: public trust grows through visible ethical reform and uniform national IT system that guarantees transparency and fairness. Asia has many remarkable clinical and scientific best practices in transplantation. I have selected these 6 national programs from known high-income countries because each has successfully overcome key obstacles they face through national unity and innovative policy. This experience reminds us that progress in transplantation is not only about technology, but about trust, leadership, and shared responsibility. I hope the wisdom of this program will inspire and guide many Asian professionals and policymakers striving for self-sufficiency in organ donation and transplantation. Thank you very much for your attention.